Hello friends! Today we are going to be talking about patellar tendonopathy, aka jumper's knee, aka my knee hurts because I've been on it all day in a squat position. So we're going to talk about what is it, how do you get it, and what are some things that we can do to provide some relief, essentially, and eliminate it. Before we get started today, my name is Mark. I'm a doctor of physical therapy. One half of Mobility Duo with my wife, who is a certified yoga instructor, massage therapist, etc. We are health professionals and athletes working primarily with snowboarders for prevention, rehab, mobility, flexibility, you name it. So subscribe below, it really helps us out. Let me think. Yeah, let's get started. We'll start with what is it. So I'll try to add a anatomy picture right now. So essentially what it is, the patella is a floating bone that sits in the quadricep tendon. This tendon attaches to the quads, the muscles that sit in the front of your leg, and attached to the front of the tibia that sit below the knee. What's going on is it's a repetition of use in that quadricep. So what happens is you have some micro tears, specifically below in the bottom of that patellar bone that sit right below your knee. And over time, this creates inflammation and swelling and essentially pain. Every time that quadricep is loaded, so every time you extend your leg, like so, that tendon is going to get loaded and you're going to feel pain. So that's what it is. So how do you know if jumper's knee is what you have or is what you're complaining of? So essentially there's no real kind of one-size-fits-all for symptoms for jumper's knee specifically, but you'll see this a lot of times in sports that have regular jumping such as basketball, volleyball, things like that, things that load that leg and quadricep and kind of release. So specifically for snowboarders, this is really common because you are in that loaded position, you're going over rough terrain over a period of 4 to 6 hours a day. So one of the big giveaways is the pain will be specifically on the lower part of that patella. So if you push down on that tendon specifically or on the lower part of that bone, or you could even find it on behind the patella when you're pushing down on it. And also pain with extension, in that lower leg. So those are usually the giveaways for that. So how do you develop jumper's knee? Find that people may have poor foot mechanics. So there's muscles surrounding the ankle. You could have, generally there's some weakness in that quadricep, weakness in the hips, and then another often overlooked weakness is in the calf or, the gastroc or the soleus muscles, which are very, very important as well. All right, the good stuff. So you think that you may have jumper's knee or patellar tendinopathy. So what do you do now? First things first. With any type of inflammation, it's substantial rest. Rest is very, very important. I know that's not what you want to hear, but the acronym PRICE, protection, rest, ice, compression, elevation, all extremely relevant in this case. So ice is very important, especially with inflammation, because you want to dampen that down to allow for healing. You want a little bit of inflammation, but specifically you want that in the tendon, not the surrounding tissues. So ice is going to be really important. If you put an ice pack on, say 20 minutes at a time, you can do that a few times per day. Elevation is going to be important to draw back that swelling, to remove that swelling, again, to provide substantial healing. Protection, again, this is all kind of relevant to how you feel. They're coming out with more research now saying loading that tissue to a degree is just as beneficial. So generally you want to stay below that kind of 4 or 5 pain range. If you're going past that, you're doing too much. So some other things you can do are, you'll see a lot of basketball players with, and I'll try to show a video of this. They have a compression kind of band that you put around right below your patella, and essentially what that's doing is that's compressing that patella, so it's providing some relief and some support. Sometimes, or a lot of times, that can provide enough relief so for the athlete to perform their sport without major complaints or detriments to their performance. So that is a great purchase. You can also use tape. Kinesio tape, or they have special kind of tape in athletic or PT departments that work well. One of the big ones for kind of long-term relief is strengthening those muscles. So like I mentioned before, you have the ankles, the quads specifically, you have the hips, which also play a part in the knees, and then you have the calf strengthening as well. A great starting point for this is in the description below. We have a kind of a 2-week strengthening program that kind of hits all of those muscles. It's a great start for you if you are not knowing what to do or where to go. Check that out in the description below. That is a great start for kind of overall lower extremity strengthening. Another thing that you might see now that has mixed research, but it's cross-friction massage. I'll show you another video of this. Essentially what you're doing is you're going perpendicular on the tendon. So let's say this is the tendon, this is the patella. You're just adding some cross-friction massage relatively aggressively on that tendon. What that's doing is that's kind of promoting that inflammation, because it is important to a degree for that regeneration of the tendon, for the collagen to kind of realign, for those micro tears to heal. Again, you'll probably want to look on YouTube for some videos. I can also do this in the future for how to do that correctly. There will be a little redness and swelling with it, but it has shown to be pretty beneficial. Lastly, we want to stretch. So I know everyone knows that they should stretch, but nobody does. But it's very important that we stretch those quads so we can provide it some relief, so we can give those quads some room to move, especially if that tendon has micro tears. It means the tendon or the quadricep is tight, and you want to give it some room to breathe. So, you know, you can do a standard kind of quad stretch with holding your leg behind your back, trying to keep your knees even with each other. I don't want you to lean forward. And you also stretch your hamstring. A great one for that is lying on your back. If you have a dog leash, kind of put it over your toe, keeping your leg straight. It's going to be a gentle massage or gentle stretch, 45 seconds minimum. And again, it's kind of that gradual stretch. I don't want you to kind of dive right in where you're screaming in pain. So 2 to 3 times, 45 seconds each time. You need to do that 3 to 5, ideally 5 days a week, to really see pliability changes in that muscle. Okay, that's it. So today we went over what is it, how do you know if we have it, what are some things that you can do to kind of provide some relief. Hopefully this was helpful. I know someone who personally deals with this. It's been very helpful for me, especially that PRICE kind of acronym. Let us know what you think in the comments below. You know, is this something that you have dealt with in the past before? And let us know if some of the things that I suggested have been helpful for that knee pain. Otherwise, again, it could really help us out. Subscribe, comment below. Otherwise, yeah, we'll see you next time.